Hi, I'm Jennifer Smith.
And I'm Melva Jones.
And we are Women's Health in Black and White. Today, by special request, we are covering recurrent vaginal infections. We're going to do it in two parts. I've got bacterial vaginosis for one, and candida, which is yeast, for another one. So, bacterial vaginosis is not sexually transmitted.
Right.
But you are way more likely to get it
if you're
having sex.
But yeah, that is a common misconception. It's not an STI or STD if you're using the older term. But it is it's more common, I think, than people talk about.
Very common. It's at least as common as yeast infections.
Yeah, it is. And it's nothing to be embarrassed about. Like, you shouldn't walk around, like, you'll know, Jennifer's going to go into more detail, but you will know that you have BV.
Yes.
And if you don't recognize the key characteristic of it, then we go back and look at our hygiene video that we did earlier.
Absolutely. So, bacterial vaginosis is an overgrowth of bacteria in the vagina. Now, vaginas are warm and moist and dark, and bacteria loves warm and moist and dark, and it grows very well there. There's lots of bacteria on our skin all the time. Thank God we don't have microscope vision.
Yeah,
I would be too grossed out to sit here.
Yeah.
We are literally covered in bacteria all the time, and many bacteria are helpful to us. Many bacteria do things like digest our food.
Yeah.
And they keep our pH balance regulated. So there are healthy and good bacteria that they keep our immune system regulated, that are beneficial, that we need. This is an overgrowth in bacteria that can cause an infection.
Yeah.
There's several different bacteria involved in it. One of them is called Gardnerella. There's several others. All of them fall under the heading of bacterial vaginosis.
Yeah.
You will know you have this infection because you will have increased discharge. Now, there's a lot of reasons women can have discharge all the time. You're not supposed to be dry.
Right. Discharge is normal.
Discharge is very normal. And a lot of girls, especially young girls, come to me and say, I've got discharge. It's perfectly normal. It's absolutely perfectly normal. The type and consistency of your discharge changes throughout your menstrual cycle. So you'll have days that are more dry. You'll have days that are more wet. That is very normal. It is not normal that your discharge be green, frothy yellow.
I feel bad that we have to say that.
I feel that we have to say that.
But we do.
Gray is not normal. Thick and clumpy is not normal. Bacterial vaginosis tends to be thin, milky, gray, or greenish.
Yeah.
It has a strong, foul, or fishy smell, and the odor can be significant. Now, our vaginas have an odor, and it is a perfectly normal body odor.
Right.
So just, I smell, isn't a cause for alarm, especially if you've just worked out, or just had sex, or just, we all smell a little bit. But if it is very strong and fishy and foul and unpleasant, it's more likely to be an infection.
Right.
There's also itching. Now, it's not so much itching with bacterial vaginosis, but some women do complain of it. Usually it's irritation. People say, I feel like somebody took sandpaper to me. They just feel raw and irritated. They can feel swollen, and it can be painful. And you can even have pain with urination. Now, a lot of people confuse urinary tract infections with vaginal infections. And they'll come to me and say, I think I have a UTI, and they clearly don't. Their urine is fine. But when you pee and you have burning as it travels down your urethra, that's a urinary tract infection. When you pee and you have burning as it hits the tissue of the vagina, that's a vaginal infection. Yeah. So a lot of people will get them during pregnancy. That's very common.
It is.
And why you get them is because your acid-base balance, the pH of the vagina, gets thrown off. That's why you get any vaginal infection. That's why you get yeast. That's why you get bacterial vaginosis. Being pregnant changes the pH of the vagina all by itself. The vagina ordinarily is a kind of an acidic place. Pregnancy makes you a little bit more alkaline. Having sex increases your risk of getting bacterial vaginosis because semen is alkaline. And if you are especially sensitive to that acid-base balance, just having semen in the vagina could give you a bacterial vaginosis. Douching will mess you up, girl. I don't know who told you have to douche, but they lied to you. You do not have to douche. And frequently when you do, you're going to come into me with a vaginal infection. Sitting around in a wet bathing suit for a really long time.
Or wet workout clothes.
Wet workout clothes, absolutely. I want you exercising, but I don't want you hanging out in wet clothes that are just going to hold that bacteria there.
Yeah.
And make it grow even more. Soaps can do it.
Yeah. Soaps
like antibacterial soaps that are going to kill off some of your good bacteria, allow the bad bacteria to grow unchecked. So you want to use a mild soap, preferably one without perfumes and dyes.
Right.
I usually recommend Ivory. Or there are some soaps that are designed specifically for the vagina. Now, Ivory works. You don't have to spend extra money.
Right.
And the vagina, for the most part,
pretty cost friendly too.
Pretty cost friendly. The vagina, for the most part, is self-cleaning. You don't have to get real aggressive with soap and a washcloth up there.
Yeah.
Wash, but mostly you're washing the external genitalia. You don't need to be really aggressive scrubbing the internal genitalia.
And that's going to be painful anyway.
I have for years heard that using Always pads. Now, I in no way mean to slander the Always company.
Right.
But I have had many nurse practitioners tell me that when a patient comes in with recurrent bacterial vaginosis and they say, "What pad are you using?" It's Always. But also just wearing a pad every day.
Yeah.
Wearing a pad every day holds that bacteria and moisture up against the vagina. It doesn't give you a chance to breathe. And if you are really embarrassed or grossed out by the idea of any kind of vaginal discharge and you just want to wear a pad, you're probably going to find that you have more of these infections. You need to breathe, girl.
Yeah.
You need to breathe. Silky underpants, same thing.
Right.
Silky underpants don't let you breathe.
They don't.
They are great for their 10 minutes right before they hit the floor. That's when they're great.
Right.
But for the most part, I would recommend a cotton crotch because it's going to let you breathe. Yeah. And it's going to help prevent bacterial vaginosis.
And even, sleeping without underwear can be beneficial to kind of let things air out during the nighttime. Just let some air circulate. And like she said, a lot of women do wear like at least panty liners because they don't like that natural discharge. I mean, we're not saying don't wear your panty liners, but also know, like, do it in moderation. If you're really having problems, I mean, you may have to change underwear, that's fine, but constantly having a panty liner or pad on every single day is going to put you more at risk for that.
Yep. So if you find that you have recurrent bacterial vaginosis, if you have it once a year, it's probably not something that you're doing wrong.
Right.
You just had bad luck that month.
Yeah.
I'm sorry. A lot of people will find that they get BV right before their period.
Oh, yeah. Yeah.
That happens a lot. And then it can spontaneously resolve after your periods for some women. But if you have it once or twice a year, not a big deal. We don't have to do anything special. We don't have to change how you live your life. We'll just treat it. But if you find that you have recurrent bacterial vaginosis, that has huge impacts on how you feel about yourself. How you and your partner relate, whether or not you're having sex, and it's uncomfortable. It's painful. Don't live like that.
Right.
We can do things about it, and some of those things are lifestyle changes, like not wearing the panty liners every day, maybe sleeping in the buff at night, not douching, maintaining your pH by wearing a condom for sex.
Right.
That kind of stuff can help a lot. We will treat an active infection with an antibiotic, usually called Flagyl. And Flagyl comes in either a pill form or something called Metrogel. Flagyl tastes like, whoa.
It is disgusting.
It tastes like a copper spoon in the back of your throat.
It does.
So, if you're given a prescription for Flagyl, and weirdly, Metrogel can do the same thing. You can get that weird copper taste even with that.
Wow.
It's not everybody complains about it, but I've had women complain about it.
Yeah.
If you're given a prescription for Flagyl, and you are not a diabetic, also get the strongest tasting candy that you like. Licorice works really well, but if you're not a fan, peppermint, cinnamon discs, Sour Patch Kids.
Right.
Really strong tasting candy will help cut that taste of the Flagyl. So what you'll do is you'll take the pill with a big glass of water, then you'll eat a couple pieces of candy and go brush your teeth.
Yeah.
Absolutely not should you ever have any alcohol with Flagyl.
Oh, yeah, no.
And I wouldn't even use Listerine mouthwash. It's got alcohol in it.
Alcohol.
And if you accidentally swallow it, you will be so very, very, very sorry that you did.
And it's even like a few days after you stop your medicine, you still need to avoid that alcohol. So a lot of people are like, oh, you know, I'm on my antibiotic, I'm not going to drink, but Saturday I'll be done, so I'm going to drink Saturday night. It will still make you very, very sick.
It really will. And I knew it, and I knew to tell patients that, but I didn't think it was really a big deal until it happened to a friend. We were out, and somebody else had a martini, and she said, I'll just have a sip. She spent most of that night in the bathroom.
Yeah.
And it was one sip. So please take that seriously. So we will treat an active infection with antibiotics, and we will prevent recurrent infections with those lifestyle changes. The other thing that can be done, which works wonders for some women, is boric acid suppositories. Now, I know that sounds crazy.
Right.
No one wants an acid of any kind suppository.
Right.
But what it does is change the alkaline nature of the vagina that has this recurrent infection to a more acidic vagina, promoting good healthy bacteria and not the bad bacteria.
Right.
So you can also take an oral probiotic to introduce good healthy bacteria back into your system.
Yeah.
That is how to get rid of those nasty recurrent bacterial vaginosis infections. We will talk about yeast in another video. If you have any other questions or concerns, this was a viewer request, and we are happy to do them. Right. Just shoot those requests to us on Facebook,
Instagram, Twitter. Follow us on our podcast Afterglow. And, you know, any topic that you want us to address, please send it to us. We do honor our request because we want to give you the topics that you are near and dear to you. So please send those to us, and we will try to cover them as soon as we can.
And like and copy and share, because the more attention that we get, the more we can keep doing these videos.
Right.
Thanks, and be well.